This is part 3 of urinary voiceover PowerPoint lecture. All right, so with this picture, this is a little continuation of the last slide on the last one. But I want you to take notice, again, of some very important information that we have here. You know to look at the top, the different, again, this is that 3-step process. Glomerulofiltration, blood from the renal artery filtered in the glomerulus. The filtered product, which contains water, salt, nutrients, waste products, is glomerular filtrate. Okay, and so again, this comes through the renal artery, several smaller arteries, then through the afferent arteriole into the glomerulus. We've got that Bowman's capsule here around. And as you can see, we have some different things going on here. H2O, urea, uric acid, glucose, amino acids, and our salts there, all circling around, being filtered, okay? And so our tubular reabsorption, nutrients and salts that are reabsorbed, transported by the peritubular capillary network. And of course, some water is reabsorbed into the capillaries here. We're getting all this reabsorption through these red turning into purple and eventually blue tubules. These tubules receive the filtrate from the glomerular capsule and reabsorbs water and electrolytes through active and passive transport. The descending loop of Henle passively reabsorbs water from the filtrate. The ascending loop of Henle, and we're looking, let's see, is that on your picture? And that loop of Henle is right in here. You have your descending loop of Henle, and then this part here is your ascending loop of Henle. The ascending loop of Henle passively reabsorbs sodium and chloride from the filtrate, helps to maintain our osmolarity. And the tubules actively and passively remove sodium and water. The filtered fluid is converted into urine. And so what's not reabsorbed through this passageway, intermingling blood vessels and blood veins, what's not reabsorbed, what's not needed any longer, goes out again through the collecting ducts to be excreted. Okay. Urine flows from the renal pelvis of the kidneys through the ureters and empties into the bladder. Again, blood coming in, filter, 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 filter. The loop of the descending loop of Henle and the ascending loop of Henle through these interchanges here, trying to absorb what we need so that we can put what we need back into the system. The tubular reabsorption of nutrients and salts, actively reabsorbed and transported through these peritubular capillary network, and then eventually to that renal vein and out to the body. And then of course, what's not used, what's not reabsorbed in here, continues through the yellow tubules represented by yellow into these collecting ducts and will eventually, of course, be excreted from the body. And what we have here, water, salts, urea, uric acid, ammonia excreted. So your hormones control the body's final opportunity to remove sodium and water from the distal tubules and place them back into the peritubial capillaries and then into the renal vein. But if we have some dehydration, some of the water and sodium may be retained so that we don't continue to have further dehydration. Elderly consideration with the renal system, they have decreased renal blood flow. Again, from that 1% rule. Also, decreased blood flow can add to, with elderly as well, think about urinary retention. And so with urinary retention, what's urinary retention? And you may have experienced this yourself if you've ever had a urinary tract infection, but urinary retention makes you feel like you have to pee, but you go and try and nothing happens. Urinary retention, again, can be caused by medicine. For one thing, medicine like antiarrhythmia medicines like Norpace, antihistamines like Benadryl, antispasmodics like Ditropan, tricyclic antidepressants like amitriptyline. We can also have urinary retention due to an obstruction. And with an obstruction, we're going to talk about kidney stones. That's one potential for an obstruction. Also, a tumor could be an obstruction. We also may have a urinary tract infection. And of course, that's infection, inflammation, swelling. So a urinary tract infection plus another complication called pyelonephritis. And it could also be due to the neural system if we've had a spinal cord injury. So those are some things to think about with urinary retention. And so just that's like I said, keep that in mind when we're thinking about the urinary system. And we'll go further into this as we move through the PowerPoint. Okay, our next slide shows a kind of a bigger process, hopefully more, help you with your understanding. So the afferent arterioles bring that blood in. This is essentially your glomerulus here. Filter, filter, filter. You see a little bit of a different view here. We're filtering, we're filtering, we're filtering. And with the filtering, right here is your filtering in that part A, and as it's filtering, it goes out into these little network of veins. So what can be saved, electrolytes that need to be saved back into the body will get reabsorbed, and in from the tubules into reabsorbed back into that bloodstream. And what's not reabsorbed, our waste products will go out back from here to here and go out as urine. All right, our sympathetic nervous system can control our urine production through the adrenal medulla, and secretion of epinephrine, norepinephrine by either vasoconstriction of the afferent arteriole to decrease the filtration, so that we don't have to stop and pee when we're in the middle of that fight or flight response. Also, another elder consideration, decreased glomerular filtration rate. So it takes longer to filter. All right, so filter selectivity. So the filter, again, this is your filtrate, and so this is the blood that's being brought in to be filtered in the glomerulus. And so some of the normal things you would see in the filtrate that goes back to the blood, back to the body, is of course some sodium, your vitamin B here, your creatinine, some of that can go back in. And let's see, we have sodium, um, glucose. Looks like we have a little bit of glucose there. Again, that can go back into our, as filtrate, go back to the body as well. So creatinine, glucose, sodium, these particles, a little bit of urea maybe, even go back in as filtrate. Now, if you notice, we have red blood cells here, and you notice they're not going through this filter, okay? And so they're not supposed to. Again, they're not supposed to be going through. Also, protein. We don't see any protein in this filtrate. A little bit of glucose can be normal and would not show up, but if it's a lot of glucose coming through, that's going to show up on that urinalysis. And so if there's a lot of glucose showing up on that urinalysis, makes it positive. We look at, that's one of the things physicians, besides doing an A1C, can also check the urine, because if we're spilling a lot of glucose in our urine, that could indicate a potential for diabetes, type 2 diabetes, that elderly people sometimes get in their later years, I'd say from 40 on up. So something to keep in mind. Got to take care of our kidneys as well. All right, so site of the reabsorption, this has some labels here. We've got going on, remember what stays in that stays in that yellow will be excreted. And so as the loop back and forth with the blood vessels, that we note on page 378, that tingling, tangling of blood vessels that start red, become kind of purple, and then go to blue. They would be intertwined in here to be reabsorbed. Okay, and so in this picture here, we're showing some reabsorption of water, some sodium chloride, to be sent back to the body, a little glucose, here's a little bit more, here's some sodium, some more water, some potassium, all going back into the body. And of course, we've got some particles that go, that will be excreted, the waste products, to be excreted out through the collecting ducts. Okay. Let's see, the reabsorption. Okay, I'm going through your textbook. Make sure you read over the clinical application on 382, polycystic kidney disease. Also, the clinical application of the trauma, ischemia, and kidney damage. You need to read over that. But let's also look at page 385 together. At the bottom of page 385, there's a table called individual tubal functions. And it also kind of shows you and gives you, it's similar to this, kind of gives you an idea of what is reabsorbed or secreted and where. Just, it's more for interest. You don't have to memorize that because, again, it's very selective. Things are being reabsorbed here, there, all the way through this beautiful process, different colorful process of the filtration, reabsorption, and secretion with the blood vessels as well. Okay. All right. Your tubular reabsorption and secretion also uses countercurrent circulation. The ions move across cell membranes from higher concentration to lower concentration in that filtration. Okay. All right. That ends this portion, part 3, and I'll get started on part 4 in just a little bit. Thank you much.